So I guess for starters, what is PEDV? And I'm going to use the acronym only because it's a mouthful to say otherwise. But what we've diagnosed, it's Porcine Epidemic Diarrhea virus. And it is a coronavirus. It's in the same group as TGE virus, but it is not the same as TGE. It is an RNA virus, which means it's just a single-stranded virus versus a DNA, which is double-stranded. And this is important because RNA viruses are known to mutate. So those of you who are familiar with things like influenza and PRRS, those are also RNA viruses. And that may come into play down the road as we look at PEDV. Really, when this all came to pass, there has been a very huge coordinated effort between a lot of different stakeholders. So U.S. Department of Agriculture, USDA, has played a very pivotal role in working with the industry on getting the news out on this disease. The National Pork Board, we've been involved in different activities, as well as the National Pork Producers Council, the American Association of Swine veterinarians, and then a lot of other key stakeholders as the diagnostic labs, universities, etc. So it's been a very coordinated and focused effort. So again, what is PEDV? Well, obviously it's a diarrheal disease of pigs. It affects pigs only. It does not affect humans. So that's been a question that we've had because this is not a zoonotic disease, therefore it does not affect our food safety. It has been recently found in the United States because of cases of scours that have not come back as a TGE diagnosis, and that raised some alerts for a lot of people. We had our first confirmation on May 16th, and that's when the official announcement was let out. Since that time, we have gone back and done, or not we, but the industry has gone back and looked at retrospectively what happened some of the other samples, and we have identified some earlier cases as early as mid-April. But however, this became official as of May 16th of this year, and that was through confirmation at the National Veterinary Services Laboratory in Ames, Iowa, which is a USDA laboratory. So PEDV, it's not a new disease, and we don't consider it as an emerging disease because this is found in many other parts of the world. It was identified in England, for example, in 1971. It's been in various parts of Europe, and then also in Asia, to include Thailand, Japan, and China. We do consider this as a production disease. A lot of people ask, is this a foreign animal disease? No, it is not. It is a production disease. It affects productions and affects pigs only. As we look to the future, we want to look at our opportunities to control and manage and potentially even eliminate this virus. Once we gain and continue to understand how the virus operates, how it transmits, and different things like that. And Dr. Connor will be covering some of those efforts. So again, I wanted to list what it is not. There's been several concerns from our retail and trade partners about the impact on food safety, and we know PEDV is not a zoonotic disease, and zoonotic means that a disease that can transmit from animals to humans or from humans to animals. So we know this is not a zoonotic disease. Again, I've stated this is not a food safety concern. It does not affect people. It only affects pigs. It is not listed as an OIE disease, and OIE is the World Animal Health Organization. They're the ones that set the standards for what diseases are or are not monitorable and listed, because sometimes a listed disease will have implications for trade haltage. So it's not a listed disease for OIE. This is also not a federally reportable disease here within the United States. And also, because of that fact, we do not have any trade restrictions between movements within a state, intrastate, or between states, interstate. Obviously, any of the movement restrictions or things that may happen would occur within a vet-client relationship, trying to at least preserve or prevent this further spread of the disease. So right now, there should be no trade restrictions. We had a talk yesterday, and a representative from the United States Department of Agriculture said basically they've only had 2 inquiries on this disease from other countries. One was from Canada and one was from the European Union, and those questions were just basically asking what's going on in the United States. So we know of no other issues currently with trade. Symptoms are very similar. Obviously, this is from my discussions with other veterinarians. Dr. Connor could probably fill us in on some personal experience, but this is similar to TGE. Both of these diseases do cause diarrhea, they do cause vomiting, and so we will see those in adult swine, baby pigs, as well as nursing and growing pigs. The thing that we are seeing and hearing reports of, it is very severe in pigs that are nursing, and can be as bad as 100% mortality up to 7 days of age, and even up to 90% mortality for pigs as old as 21 days of age. So it is very devastating in the farrowing house, and a lot of losses are due more to dehydration, because this virus, just like TGE, will attack the cells that line the intestines and line the gut, and basically don't allow that pig to be able to absorb any nutrients. So that's where a lot of the death loss comes from. It does affect older animals, and they can see a reduction in production and weight gain and things like that, again, just because of being ill and having that in their gut. We don't think this is a disease that causes a viremia, and it is very localized in the intestines, so there is some differences there. So how is it diagnosed? Obviously these two diseases, TGE and PEDV, look very similar. So really the only way to be able to tell the two apart is to take samples of clinically affected pigs and submit them to a veterinary lab. And that's working with your veterinarian to get that done. We have a lot of laboratories that are working together to make sure we maximize our tests and have good test results across each lab. I've got listed Iowa State, the University of Minnesota, Kansas State, South Dakota State, and then also the National Veterinary Services Lab in Ames, Iowa. There's a lot of work that's been going on since the original diagnosis of this disease, but there's also going to be continued work because we still have to get some additional diagnostic tools in our toolbox to do some rapid testing and rapid evaluation of the disease, and those things are going on as we speak. Do want to make one point, though, that a lot of people have said, well, we may have seen some scours, we might not have tested for it, do you think it was PEDV? Because these two are really hard to tell apart clinically, it is best to work with your veterinarian to submit samples if you have a scours case that you're not sure why it is, and submit that to the diagnostic labs for confirmation, because that can also help you make sure you're doing important things for biosecurity. TGE is also a production disease, and those of you that have been through it know how devastating that can be, but it's still important to get a diagnosis just so you know what you are dealing with. We have had positive samples identified in 5 states. We had a presentation yesterday that listed about 10 different states where cases have been identified across the Midwest. And we know we've got about 103 total sites that are affected within those 10 states. It has been identified on both sow farms and on growing pig sites. The growing pig sites, we're not completely certain if they're all nursery or finishing, but it is growing pigs. It's not just the sow units. We do have concerns, or at least early on there was concerns, are there other point sources that could be attributable to this disease? Because one of the biggest questions that comes up, we saw a lot of these outbreaks all in a very short amount of time and across a wide range of states and in unrelated farms. And so a lot of people were thinking, okay, what are some common things that might be a problem? And one of those things has come up from some feed sampling. Currently, to date, we do know that our positive samples and confirmation of the disease has come from ill pigs. So all the confirmation we have is from pigs that have had clinical signs and symptoms. There was some concerns about feed and feed ingredients, so the USDA was working with their partners, the Food and Drug Administration, to go back and look at, is there a potential this virus was carried in on feed and or feed ingredients? The FDA is one that actually does the oversight for all of our animal feed, so that's why they were involved in this process. So there was a collaborative effort to get that done, and so far to date, according to a release by USDA, there has been no positive samples identified out of those feeds and feed ingredients. However, there are still samples that are ongoing and testing that are being done, and as soon as USDA has those results, they will make a public release on that information. But currently, right now, as we know it, there's no positive feed samples. So what's next? For us, at least at the National Pork Board, we know there's a lot of researchable questions that are out there as far as this virus, and the question came up internally about the need to have some supplemental funding. So earlier this week, my boss actually went to the board of the National Pork Board and requested supplemental funding to be able to use to investigate this disease. So We have, I'll tell you about that in just a minute. But we do have funds. So the nice thing is, we have $410,000 that was approved by the board for use in research. That is combined with another $40,000 that our Swine Health Committee has remaining in this year for looking at general swine diseases. So combined, we will have immediately $450,000 that we will utilize to address research priorities for the investigation of porcine epidemic diarrhea virus. Some of the things that we're going to do that I have listed, Dr. Burkgren will be covering a survey that we're looking at. So a lot of the funds that we have, or some of the funds we want to use to get this survey out to the veterinarians who've had farms that first broke to better understand what's going on. We may have to follow up with an additional survey to really get into some of these other secondary farms that broke. Why did they broke? Is it a biosecurity thing? Is it a trucking? Just to really help us understand how this virus is moving around and what can we do about it. We want to know, is there a carrier state? How well do animals build immunity and how quickly is that built? How does this transmit? Is it along trucking? Is it along fomites as far as contaminated boots and gates? Does this go through other routes? And then also look at a challenge trial. How long do pigs remain infective once they're challenged with the virus? How long does the virus remain in the herd? These are all things that we need to know in order to manage it down the road. I've mentioned before diagnostic tools and validation. We're still looking at how we can have some rapid on-farm testing, look at ELISA for serology. Right now, most of our testing is done with antigen that we're looking directly for the virus. So we're wanting to have some tests that we can use antibody to be able to tell from a blood test, where did this come and pinpoint when it got in here? So we're working on those. And then lastly, look at viral propagation and survival. What the viral propagation is basically how can we grow this in cell culture to get enough virus material in order to look at making a vaccine. Because currently there are no approved vaccines for PEDV in the United States. And what we do know of the coronavirus and the PEDV virus is those two, while in the same class, are not similar enough to be able to confer cross-protection if you have one or the other. So that's an issue. And then lastly, we just want to look at survival of the virus. How long does it last in manure? How long does it last in water? Can it survive in feed? How much moisture does it need? Humidity, pH. So those are some of the things we want to investigate. So we're going to be working, and we are working currently with our Swine Health Committee, with American Association of Swine Veterinarians, NPPC, other stakeholders, USDA, universities, other diagnostic labs, to really circle in our priorities and get a call out as early as next week. Our goal, we want to get this addressed rapidly and address this problem for the key diseases that we need to get rapid results back. Because we know in our normal research process, it takes a while to get a lot of this information out. We want to be rapid and transparent and get information back to you guys that helps you better manage this on your farms. Hopefully you all won't see this. But I will now turn it over to Dr. Burkgren. We will have questions at the end, so we will address those as we go on.
Good morning. Well, hopefully, if you didn't realize it before, you'll realize it this morning that on May 17th, the world got a lot smaller. And that was the day that the USDA declared that we had PEDV, that it was confirmed by National Veterinary Services Lab in Ames, Iowa. Now, those of you that are not familiar with our association, the American Association of Swine Veterinarians is a membership organization. We have members in about 44 countries currently. Our members are pig veterinarians who work with pigs, some full-time, some just part-time in their practices. We have about 900 members inside the United States, and at the front of this issue, the herd veterinarians working with the producers on those first diagnosed herds were the ones that contacted us and requested that we become involved. And so that's how we became involved with this. One of the main things we're doing is the investigation into answering the big questions. How did this get into the United States? Why did it appear in these herds and not in other herds? And so this was our start of an investigation. We're looking at the primary infected herds. Those were up at the front. We think right now that April 15th was the earliest diagnosed case. And we want to look at those herds, not necessarily the herds yet that were more secondary, that maybe were lateral transmission spread from farm to farm. And so we're looking at any stage of production. Could be a sow herd. We've seen it in growing pigs, nurseries, finishers. And we're looking at the risk factors. We're trying to confirm what's different about these farms that were positive from farms that are still negative? And to do that, we're using the herd veterinarians to complete this survey. The survey is about 13 pages. It's very in-depth, a lot of questions, a lot of digging into the information on those farms. I have to say also right up front is these surveys will be held confidential. And so there'll be no identifier of herds, producers, veterinarians. Once it goes into our database, it'll be washed. There'll be a herd identifier, just a unique number, and we'll know what state. But other than that, we will not record anything about the infected herds. We want to be able to characterize the clinical presentation. What does it look like? We get a lot of questions about it. You hear rumors that it's everything from really explosive to just kind of a chronic diarrhea. And so we're trying to get at least a handle on that entire spectrum of clinical signs on those farms. And also important with this is we want to look at those negative herds. Those are going to be our case controls. There's a lot of swine farms in the United States that are not infected. What are they doing differently that kept them from becoming infected with this virus? So we're looking at herd information. The number of pigs, the size of the pigs on that farm. We want to know about how close are other farms to you. We want to talk about biosecurity on there. What are you doing? Are you washing trucks and trailers coming back on? What slaughter plants are you going to? We want to know personnel that are entering and leaving your farm. All entries are important. Whether it's the mailman came to the door one day, service guys, whatever it is, nothing is too insignificant for this survey. We want to turn over every stone that we can. Again, trucks and trailers. And then we want to also know about security breaches and things that may not come to mind, but, is there a door left open that wasn't supposed to be open? Is there a bin lid that's open one day that shouldn't have been open? No feed was delivered. Anything that's really unexplained. And so our veterinarians are asking producers about that, asking people that are in the barns, running the barns, is there anything unusual at any time in April or May? Trying again, let's uncover every stone that we can. Inputs, everything from semen to vaccines to injectable antibiotics. What are being used? We're looking for that common factor. And the reason we want the negative case controls, again, is, for example, if we discover that all these pigs on the positive farms drank water, you could leap to the conclusion, well, it must be the water. But then you look at the negative herds, and the negative herds, those pigs drank water too. So that eliminates that. We want to know about feed. Where's your feed coming from? Is it toll milled? Is it mixed on the farm? Feed ads, vitamins, lysine, base mixes, premixes, protein sources, all of that could be a carrier for the virus coming in. And the clinical presentation, that again is just what does it look like? The clinical signs, vomiting, diarrhea. We want to know the date of onset. When did you first notice? Morbidity. How many pigs got sick? Early reports look like 100% of them in those farrowing rooms are getting sick. Mortality. How many pigs died? And we know that it is pretty deadly in pigs less than 2 weeks of age. Less so as the pigs get older, and less so certainly in sows. We want to know what samples you've submitted to the veterinary diagnostic labs. We're in communication with all 4 of the labs that Lisa mentioned, University of Minnesota, Iowa State, SCSU, and Kansas State. And they all have testing capabilities now. We also know how those pigs recovered. How long did it take from date of onset of clinical signs till the herd was recovered? That just helps us, again, really typify what the clinical presentation is. Once the information is gathered, the data analysis will start. And I guess I do have to say that the survey is out. We have about 25 veterinarians that are working on surveys currently. If you're a producer, you have a positive herd, your veterinarian hasn't contacted you, you might ask your veterinarian about that to get one of those surveys if you're willing to spend the time to fill it out. I can't underestimate how important this is. Because if you think about the incursion of a virus that we've never seen before, and this virus isn't exactly as stable as foot and mouth disease or hog cholera, then it should keep you up at night. because this was not the first virus we'd think about coming in. Those other foreign animal diseases certainly have a much more paralyzing effect on our industry. Once we gathered information, then we're going to analyze it. And the U.S. Department of Agriculture was part and parcel to the design of the survey on the front end, and they're going to be heavily involved in the analysis of data on the back end. So as the surveys come in, they go into our database. USDA will be able to look at that data. Again, it's WASH data, it's totally confidential. But they have about 18 PhD epidemiologists just chomping at the bit, waiting to get at this data. The other group we're working with is FASD, which is the National Center for Foreign Animal and Zoonotic Disease Defense. That is a center of excellence down in Texas A&M University, funded by the Department of Homeland Security. And so it's a whole other level of involvement of a group that we haven't worked with before, but I tell you, they really are ready to jump into the data analysis. And certainly National Pork Board, Lisa and her group, National Pork Producers Council, Liz Wagstrom, veterinarian there, the chief veterinarian, and she's been heavily involved in the design of the survey and really corralling the veterinarians on that. And then our association, AASV, working on that as well. So next steps, we are going to take a look at lateral transmission. You know, we're not talking just about the primary cases there, but more the secondary. How is it spreading? We have some concerns about how it's spreading between farms. We want to ask the question, can we contain and eliminate this virus? Is that possible? And we're only about 3 weeks into this from when we really found out we had it. And so the question needs to be asked on the front end rather than a year from now, gee, I wish we'd worked harder to contain and eliminate this. The other thing our survey is going to do, it may not show the smoking gun. We may not ever find out how it really entered the United States. But our survey is going to generate some hypotheses about how it did. And hypotheses, we hope that will be researchable questions for further research. Spend some of Lisa's $410,000. I haven't seen my check yet, Lisa. Okay. And then certainly further research that Lisa talked about.